Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
We're just now really starting to focus on how important those trillions of bacteria are in our gut and what they do.
Welcome to Petability. I'm your host, Kathy Simon, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good morning, Kathy.
Good morning, Chris. How's your day going on over there?
Day's good. I do want to tell you a little story that's going to lead into our topic today. Julep and Baxter are Cavaliers. They're 8.5 years old. Their entire lives, these poor dogs have had diarrhea on and off. And so we've had to be super cautious about anything that goes in their mouths. And it would tend to trigger loose stools, which would make training, they were agility dogs or enrichment activities quite challenging. Further, they experienced nausea and vomiting. They became inappetent or lost their appetite, and they would refuse to eat for days. We were constantly changing dog foods, and these were not your run-of-the-mill foods. These were very high-end, expensive foods, trying to do the right thing. And just when we thought we'd found the perfect food, another hunger strike would come. Periodically, it would be so bad that they would be prescribed metronidazole or Flagyl. Some of our listeners may be familiar with that, to try to break the diarrhea cycle and get them back on track. And in fact, one incident resulted in a late night emergency room visit because Baxter experienced bloody stool, and it was terrifying. I just never had seen blood come out of a rectum like that before. And I was like, oh my God. So what did I do? I called you, Kathy, and you said, I think maybe you should take him to the emergency room. It turned out that he was just experiencing some gastroenteritis or, something like that, gastritis maybe, and flared up, and it triggered this irritation and inflammation in the bloody stool. Well, about a year ago, my vet recommended a Biome test. She said she's doing more of these, and I really had no idea what this test was or what it involved, but I was willing to try anything, as you can imagine. And so next thing I knew, she was swabbing their mouths and their bums and sent these swabs off to a company called AnimalBiome. And this is where our guest today, Dr. Tonya Cooksey, is employed. So based on what was analyzed at the lab, both dogs were prescribed a powder to put on their food to rebalance their gut health. At this point, Julep is doing fantastic. But Baxter started really straining for minutes at a time and had stinky gelatinous stools that returned. And so I reached out to my vet again, and she repeated the swabs, and a slew of supplements was prescribed. We decided to start with just 2 to be more conservative, and now Baxter is also much improved. Both are actually excited to eat. We have not had a hunger strike for a very long time. Well, about the same time that this was all going on and I was having the dogs tested, I read an article in the New York Times discussing the relationship in humans of our guts to our brains. And it was specifically relating to anxiety. And I had an aha moment because Baxter has always been a very anxious boy. So I started thinking if Kathy and I weren't aware of this microbiome, AnimalBiome company and this testing and what could be done, I made an assumption that many persons in our audience, our listeners also were unfamiliar. So we are going to speak with Dr. Tonya Cooksey today about biome and with a specific focus on the body-mind connection or the gut-brain connection and how this may relate to certain behaviors such as anxiety and or aggression in our pets. Now, AnimalBiome was founded in 2016 and at this point has tested over 45,000 samples. They've seen 80% improvement in the pets that they are working with. And over 1,000 vets worldwide are using these services. So let me tell you a little bit more about our guest, Dr. Tonya Cooksey, and let's see what all this buzz is about. Dr. Tonya Cooksey earned her doctorate in veterinary medicine from Auburn University in 2006. With an interest in companion animal medicine, she worked in both private and corporate practices and taught in both a veterinary technology program and a veterinary assisting program at her high school alma mater before joining the team at AnimalBiome Veterinary. Her current role as the Director of Veterinary Relations is to be the touchstone for veterinary partners and assist in understanding microbiome medicine and how best to improve patient outcomes. Welcome, Dr. Cooksey.
Welcome, Dr. Cooksey.
Thank you for having me, Chris and Kathy.
It's wonderful to have you, and I'm really interested in this topic today. And as Chris is talking, the thing that comes up in my mind is how your gut goes, your brain goes.
That is exactly right. So, it's that whole mantra of you are what you eat kind of situation.
Dr. Cooksey, I was looking at your website and I was looking at particularly this image that was comparing what a dog with a balanced gut microbiome looks like versus a dog with an imbalanced gut microbiome. And it was startling to see how many body systems are affected by the imbalance. And it included things like chronic inflammation, heart disease, compromised immune system. But what really got my attention was the link between this imbalance and dementia in dogs. So I have so many questions about that and interested to hear what you have to say about how chronic inflammation plays a role in all of this. We did a show that we completely dedicated to inflammation back in February of 2022 called Inflammation, Your Frenemy. And we talked about the long-term side effects of chronic inflammation in the body and how it can lead to systemic problems and is associated with a variety of health conditions and how it can affect the organs. So maybe we could start off, Dr. Cooksey, with you explaining to the audience what AnimalBiome is and why it's important overall for health.
Yeah, definitely. So when you're looking at our company as a whole, we are really focused on the gut health of our patients. And it's because when we're looking at human medicine, we're just now really starting to focus on how important those trillions of bacteria are in our gut and what they do. And it's one of those kind of concepts, like I said, you are what you eat, because a lot of times those bacteria in the gut, they control, like you said, a lot more than we think. They don't just break down food. They also produce all these hormones and metabolites and things like that work in these other areas of our body and make us more balanced. So our overall goal with focusing on gut health is really just to improve overall patient health by really getting to the root cause of a lot of our conditions, whether it's in ourselves or in our pets.
Did this start in human research and then has recently gone to pets, or has it been simultaneously or vice versa?
It started really more in the human side. It usually does. Usually veterinary side picks up afterwards. But the kind of fun fact of looking at, microbiome medicine and focusing on the gut, the first real documentation we have for using some form of microbiome medicine for human diarrhea is back in 4th century China. And this physician was treating food poisoning, and he was using something called, you can't see me, but air quotes, yellow soup. And what yellow soup was he was taking stool from a healthy adult individual, mixing it with a broth and feeding it to his sick patients. And he was actually seeing those patients improve. And the reasoning behind that was because he was putting those good, healthy bacteria that patient was missing back into their gut. Now, of course, we're way past the yellow soup phase of treating diarrhea, but the concept's been around for a long, long time. It's just that we've really expanded in these past probably 10 years, really kind of focusing on how can we improve the gut? What does the gut control? And, it's kind of snowballed a little bit into companion animals, so our dogs and cats. We're seeing more studies come up looking at, like you said, the connection between kidney disease, chronic kidney disease in cats. It's kind of a chicken and the egg scenario. We really don't know what happens first. Does the gut get all imbalanced and then that causes the kidney disease to get worse? Or is it the kidney disease that triggers the gut to get all imbalanced? So there's all these little weird connections we're still trying to evaluate on both the human and the animal side. But it is such an interesting topic.
What would cause an imbalance in the gut?
Honestly, there's a lot of things. When we are born and when our pets are born, we don't really have a developed microbiome. So we have to develop that over time. So there's a lot of theories of C-section births versus natural births, vaginal births. If we're C-section, we're not exposed to those vaginal bacteria that are natural. If we have the puppy that's not nursing and has to be bottle fed, well, he's not getting those natural bacteria from mom's skin from suckling. So we have that first instinct of, okay, where do those bacteria come from? And then a lot of times we get exposed to things over time that impact that, taking antibiotics, being on certain medications. Environment, the type of environment we live in, that plays a big role on how that microbiome develops as well.
Before we get too much farther in, is the correct term microbiome? And we just say biome for short? And are you really talking about is it a whole system, or is it like the lining of the GI system? Is it specifically the flora or bacteria flora or fauna or both?
Good question. So biome is just a shorter way of saying the gut microbiome. And when we're talking about the gut microbiome, we're actually just talking about all those living bacteria and viruses and fungi that are natural in our gut and in our body, and how they kind of interact with everything. Because you have a microbiome everywhere. We have a skin microbiome. We have the GI, the gut microbiome, like we're talking about with intestines. You have microbiomes inside your bladder. So there's all these different types of microbiomes that kind of interact with each other. And really, it's just that gathering of those microscopic little bacteria and viruses that we're dealing with.
And you mentioned antibiotics. And I think a lot of people have fairly recently learned why taking an antibiotic, especially over and over again, repeated, can upset that balance. So can you explain how that works? And furthermore, I've just heard so many people in my life talking about probiotics these days.
So with antibiotics, the main goal in medicine, whether it's human or veterinary, when we reach for antibiotics, is we're trying to get rid of something bad, usually a bad bacteria. The catch with antibiotics is they're not going to identify what's good bacteria that's natural and should be there and what's bad. They're just going to wipe out all the bacteria. And so when you have all those natural bacteria that are supposed to be there in our gut and we give the antibiotics continuously, it does kill off a lot of those natural bacteria that we need in order to produce all those hormones and byproducts to actually help us function in healthy ways. So antibiotics are one of those things where they're a necessary evil, because there are times when we just have to use them. But luckily now in medicine, we're really focused on what they're calling antimicrobial stewardship, which means just really taking a step back and thinking about, do I truly need antibiotics for this? And if I do need antibiotics, am I choosing the right antibiotic for this? So definitely antibiotics make a huge influence on the bad side of the microbiome. But when we're talking probiotics, Probiotics are the good guys. Probiotics are bacteria that are actually beneficial to the body. That's why we want to put them back in. It's like when they tell us, eat more yogurt or take some Activia. Those are all probiotics. They have live cultured bacteria that actually provides a benefit to the body. And so we have probiotics for animals as well for that same reason. And another kind of form of benefiting the gut when you're talking probiotics is what we call prebiotics. And they usually go hand in hand. Prebiotics are basically fiber. So a lot of the probiotics, especially on the animal side, typically do have fiber in it because the fiber is what's going to feed those good bacteria and help them kind of thrive.
Once a patient starts an antibiotic and we've treated them with probiotics, how long does it take for the GI tract to rebalance? Days, weeks, months?
They're doing a lot of studies on this because depending upon how chronically we use the antibiotics, we're still not sure we'll ever get the gut back to where it had been originally in a lot of these times. So a lot of times what we're looking at is symptomatically, can we at least get those bacteria back into the gut in order to keep the symptoms at bay and keep this patient healthy? Typically, when I'm dealing with vet clients and they're working with their patients, it depends, but it can take a good 30, 60 days in order to really get those pets back into a comfortable place where they're not having the horrible loose stool and they're not being gassy and they're feeling really good. And we can tell that everything's really working and we're getting that gut into a better balance. So better balance is always what I like to say after we do things like antibiotics, because there really is no guarantee we're going to get it back to that original balance before the antibiotics.
Can the pre and probiotics be given simultaneously with the antibiotics, or do they undo each other?
The only one that the antibiotics will undo is the probiotics. So because the probiotics are bacteria, it kind of defeats the purpose. You're almost shooting yourself in the foot because it's going to definitely impact that. It won't impact the prebiotics since that's just fiber. But usually when I'm talking to clients, I always tell them you can either space out giving probiotics with an antibiotic or even doing them right after the course of antibiotics. So finish the course and then go ahead and start those probiotics and get the good bacteria back into the gut.
And am I right that the commonly prescribed metronidazole or Flagyl is an antibiotic?
It is. And going through vet school, that's the standard therapy they teach you in school to get those acute diarrhea cases under control. We usually would do Flagyl or Tylosin, which is another antibiotic, put them on a bland diet, and then maybe add some probiotics into the mix because we knew that there was something going on. We weren't quite sure what back then, but we knew we had to kind of help get those bacteria back with the probiotics. So that is a really common antibiotic we use for diarrhea cases. And it's just one of those things where it's a standard of care. But we're starting to realize that we can advance the standard of care and change the standard of care.
Makes sense that 90%, I read this on your website, 90% of dogs and cats experience one symptom of an imbalance of their microbiome per year. So yes, it is very prevalent.
Are there certain signs or symptoms pet owners should look for that might suggest that their animal's microbiome is out of balance?
Your most common symptoms are going to be the diarrhea, vomiting, and your skin kids. So the ones who are constantly itchy. And we're trying everything as your vet, whether it's steroids or Apoquel injections, things like that. We can't seem to get a rein on it. A lot of times that can pinpoint that there's something going on in the gut. So there's that root cause that we're missing in a lot of these situations.
Nothing's more frustrating than that skin dog. Oh my gosh, nothing is more frustrating than treating that for the clients and the clinicians.
Exactly, because you try everything. You're like, okay, we're going to try the hydrolyzed protein diet. We're going to try these pills. We're going to make sure you don't get these kind of treats. And when you have those clients who are doing everything by the book and they're listening to you and they're avoiding all what could be triggers and they're still having these problems, that's when I talk to my vets and I'm like, maybe it's time for us to take a step back and make sure everything's going okay in the gut, because the gut actually controls about 70% of your immune system. So the immune system is what's on fire in these kiddos and why they're so itchy. So if there's something missing in the gut that can help calm down the skin, we really wouldn't know unless we test the gut and see what bacteria are there.
70% of the gut controls your immune system. And so do you think that this could be a factor in some of these immune-mediated diseases or immune-mediated cancers?
They are researching that. So they're researching to see if there's a connection between helping with cancer by controlling the gut, looking at epilepsy in dogs and seeing if there's triggers going on from the gut that are causing the epilepsy. I know in both human and they are starting to look in companion animals, they are looking at certain bacteria that'll overgrow in the gut can lead to colon rectal cancer. So there are certain connections that we're starting to make, and it makes sense when you think about how much is controlled by the gut that we really didn't think about before recently.
We've ignored the gut this whole time, and it was right there.
I remember recently learning that the gut is the brain of our bodies. Somebody had said that, and I'm like, oh, well, that makes sense. So, Dr. Cooksey, we've been talking about dogs and cats. Are there other species that can benefit? I mean, we've also talked about people. So I'm assuming you said like the biome is everywhere. Is your company, AnimalBiome Veterinary, working with horses, exotics, and with other species? If that is true, are there particular species that the microbiome is more important than in other species?
Gotcha. Yeah. And we're honestly, every animal species has its own specific kind of microbiome. When we first started the company, it focused on mainly cats and dogs, but we've actually moved on to doing horses specifically as a test, as well as doing our exotic pets. Now, the reason that all these species are going to be a little bit different is, it's based on what kind of diets they typically eat. So your herbivore, plant-eating animals like your livestock, they're going to have a completely different microbiome than our cat and dog just because of the diet. There's also differences because of how their stomachs work. So, they always say cows have that rumen where they kind of build up all the bacteria and break down everything. So their microbiome is going to look different than a dog or a cat or a pig compared to a horse, which is going to look completely different too. And it's all about how they break down their food. So we are diving deeper as a company into looking at the other microbiomes and trying to track similarities between species. And it's kind of interesting because in the human side, they've been able to see that there's similarities between the gut microbiome of dogs and humans, which makes sense if you think about it, because they've been with us and domesticated with us for so long that we would have some sort of overlap with them.
Meaning similar bacteria in our guts.
Exactly.
Wow.
This is going to make Chris crazy because I love to talk about birds. I had to bring them up every podcast, but I worked for an avian practice for many, many years, and almost everything that we know about birds' health comes from their droppings. If they're lime green, we think you might have liver problems. If they're watery, maybe you have kidney problems. If they're red, maybe you ate raspberries that day. Just knowing what a healthy bird dropping and how many they have during the day is so important to their overall health and us kind of understanding what's going on in their system with all their organs, their GI, their liver, their kidneys. And so it's an incredibly important part of the diagnostic process.
Definitely. And it's funny because, we think about that with birds, but then when we look at our companion pets, we don't focus as much unless it truly is diarrhea. But there are so many things you can tell just from what's going on in the feces and what's going on with how they're breaking down their food. What are you seeing in that stool? That sort of thing.
Right. Okay. So I'm going to switch gears a little bit here. We had talked initially at the beginning of the show about can changes in animals' biomes affect their behavior or their mood. So I'd love to hear what you have to say about that. Could a disruption in the microbiome lead to anxiety or aggression? And is it linked to dementia later on in these dogs' lives? How does that connect?
Yeah, so there's actually tons of good research that's being kind of developed right now, looking at aggression and phobias in dogs, particularly, and what's going on with their gut. And what they're finding is there is a difference in those bacteria inside the gut of the fearful and aggressive dogs versus your standard non-aggressive, happy-go-lucky dogs. And it ties all in again to what those bacteria are doing. And those bacteria in our gut, it's another fun fact coming, about 90% of the hormone serotonin is produced by the bacteria in the gut. And serotonin is that feel-good hormone that goes to our brain and makes us happy about life. So when these kiddos have what we call an imbalanced gut, where they don't have all the proper bacteria, a lot of times they're not making serotonin and a lot of these other mood kind of boosting hormones like they should. And so we're seeing that displayed in the behavior. And so it definitely is something where, they've done studies looking at diets, and there's certain hormones that can be produced by adding a little bit of protein in the diet. And so those dogs tend to start feeling a little bit better because they've kind of substituted with the diet. So definitely there is this huge connection between the brain and the gut. And it's really interesting to see that, again, it's just not about the bacteria that are there. It's about what they're producing that actually gets into our bloodstreams and actually acts on the rest of our body.
I just started taking a protein supplement in the morning, adding it to my coffee. It's wonderful. I'm hoping it makes my mood better. Let's see.
So once we've tested our dogs with the AnimalBiome test, which Chris had alluded to earlier, is pretty simple, right, Chris? They just took some swabs and samples from the rectum and the mouth and sent those
painless. Quick and
painless, right? And so what's the next step? Are we going to get a report? Is our veterinarian going to get a report that says, this is what's off, this is the imbalance, and how do we proceed from there? How do we determine what natural ways we're going to support to maintain that healthy microbiome in our pets?
Yeah. So when you're looking at our samples, it's usually just a teeny tiny fecal sample. It gets submitted. And then you get a report back. And what that report is looking at is it's going to show you the actual percent of every single bacteria that was identified in the gut. And it's a DNA sequencing test. So it looks for the DNA of those bacteria and it prints up the percentages of everything it finds. And then it's going to compare it to our healthy reference set. And the healthy reference set is based on the studies done in cats and dogs, as well as our 45,000 tests that we've run and been able to kind of work with our science team to make as these are the normal and what should be there compared to what we're seeing in your pet. From there, that report will actually kind of help guide you and your veterinarian to whether or not there's certain supplements that we might be able to use to improve the gut health, whether it's putting the missing bacteria back in with our FMT, which is basically microbiome medicine. It's a native probiotic. So it is actual bacteria from healthy cats and dogs that we're putting back in. Or do you need something where maybe there is an overgrowth of something that's bad and we need something that can specifically target that? It might recommend that sort of supplement. And then it also recommends dietary changes if necessary. And the dietary changes are always, we call ourselves a food agnostic company because we focus on macronutrients. So we're not going to wave any banner for any of the big companies. We're going to talk about, adding fiber or adding protein or decreasing carbs because there's certain bacteria that'll be overgrown on the report. And I can just look at it and be like, ooh, you're on a high carb diet. Let's cut down on those treats a little bit. So that whole report kind of helps guide you on your next steps in order to get your kiddo on the right path.
I guess I'm interested and curious about how the connection between the imbalance in the gut plays a role in canine cognitive decline later on in life.
What is going on when we're looking at dementia in our patients, and they're actually looking at it also with Alzheimer's in humans, is as we naturally age, our gut loses a lot of its natural diversity. We do start to see certain bacterial groups just can't survive as we get older. And what's happening is a lot of times those bacteria that are left aren't producing the right byproducts in order to slow down the progression of that cognitive disease. They've actually done studies in mice where they have had mice that have lived in a sterile environment. They will give them, bacteria from mice that are older, and they will give them bacteria from mice that are younger, and they can actually see that these mice can't solve the puzzles and the trails as quickly because of the fact that they have that less kind of diverse gut and fewer bacteria in their gut. So there's definitely that connection where looking at maybe supporting the gut of our older cats and dogs, maybe with probiotics or prebiotics, can maybe slow down the process. It's the same sort of concept when we're talking about kidney disease, where unfortunately we can't stop kidney disease once it starts, but maybe by looking at the gut and at least supporting the bacteria that are there, we can slow down the progression of the disease in our patients.
So are we tailoring treatment based on what disease process we might be treating, or based on the information that you get from the test?
It's more of a general approach because even on the human side, we are not specifically adding certain bacterial groups just yet, like a microbial cocktail where it's like you can pinpoint which bacteria you want and just put them there. We really are just trying to get all those general bacteria that should be in the gut back into the gut. So it really isn't tailored towards a disease process. It's more tailored towards what type of imbalance is going on in the gut. Is this a microbiome where there's tons of bacteria missing and we need to get those bacteria back into the gut? Is this a gut where everything's there, but not at the right balance? Some are kind of overgrown, some are a little deficient. So we have to work maybe with nutrition there. Or, is this a gut where we have huge overgrowths of bad bacteria that we need to tackle? So it's really more looking at those kind of three states of the gut. Where is it missing things? Is it overgrown with something? Or does it have what it needs, but those bacteria just aren't at the right level? And that's how it kind of takes that AI logic of looking at your pet's microbiome profile and kind of deciding what can be helpful and beneficial in that pet.
Do we need to, at some point, retest our dogs? So if they're responding well, then we've got a good plan. And if they continue to have problems, do you retest, or do you recommend retesting in 6, 8 or months or 12 months?
Typically, we recommend retesting at least within 2 months of ending any sort of therapy. If your pet's doing awesome and the recheck looks great, sometimes we just say leave it for every 6 months in an older patient or every year in your younger patients. And it's because we want to make sure that we're catching anything that could be arising in those kiddos, especially with the older pets. So thinking about the cognitive disease, thinking about that link with heart disease and inflammation and arthritis, where maybe we can see those things popping up a little faster by looking at the gut. And like I said, supporting the gut.
I just want to circle back quickly to when you were talking about the mice in the sterile environment, and then they were given young microbiome and old microbiome, meaning from old animals or young animals. So the difference there was when they had the microbiome from the older mice, they did not do as well. They could not problem solve.
Correct.
But with the younger ones, they could.
Correct.
And then you were saying about kidney disease that, once kidney disease starts, it is a progressive disease typically, and you're doing everything you can to support it. But I also want to put good word in for our sponsor, the MedcoVet Luma, because they have one of the leading experts on their team who uses red light therapy to treat specifically cats, but really any animal with chronic kidney disease, and has had very good outcomes. So for any of you listeners out there that are interested in that, contact medcovet.com and get more information about the treatment of kidney disease.
Dr. Cooksey, is this something that has to be ordered and prescribed or ordered by our veterinarian, or can owners go right to your website and get it and send it in themselves?
Yes. So we have a consumer website and we have a veterinary website, and they can go to the consumer side and they can order the test and register their pet, send in the sample, and the report will send directly back to them. And they also can order some of the supplements for their pets there. The veterinary side, if they're really interested and they really want their vet involved, they can always send their vet to the veterinary website And from there, my team connects with their veterinarian and kind of teaches them about the microbiome. And that way they can work together in order to help that pet.
Dr. Cooksey, can you give us maybe a ballpark figure on the cost of testing?
The test is around $125 for the dog and cat. It's a little higher for the equine test, the horse test, as well as the exotic animal test. Probably only about maybe $10 to $15 more, if I'm guessing right.
That's very reasonable.
I mean, I can't tell you how much less stress my life is that my dogs eat. I spent so much time buying different dog foods and, hand feeding them and just I'm like, okay, let's feed them separately. Let's try different bowls. Just grasping at straws there. So yes, very inexpensive for peace of mind. And they're gaining weight. So my dogs, especially Baxter, ever since he was a puppy, has been a 3 out of 9 on the body condition scoring. And the last time they went, which is just a couple weeks ago, they're where they should be, right at that 5 out of 9. Is there any exciting new research or discoveries that are coming down the pike in the area of animal biome, or specifically the link to the brain, that you'd like to share with our listeners?
Yeah, so that's the really cool thing about our company. Our company is really science driven. So we have a lot of studies going on with universities. So we're doing one with Cornell right now, looking at seizures and epilepsy and how that ties into the gut. We also have studies going on looking at diabetes in dogs and cats and looking at the gut microbiome with Ohio State, and I want to say Illinois. So yeah, we do have tons of things in the works because this really is a field that's continuously growing and evolving. And we want to make sure that we're on top of our game when we're helping out our pets and our patients.
Again, I had not heard of it until recently. It seems like it is a relatively new field in that we are talking about it. There are companies dedicated to it, like AnimalBiome Veterinary, and it can only improve the lives of our pets and their people. You also have some supporting products for pet parents.
Yeah, so we have tons of things for pet parents. We have like our pill putty. Pill putty is very similar to like your pill pocket you would get to put your, medications in or hide things in. But the pill putty is hypoallergenic. So a lot of times kiddos with gut issues, they're going to be sensitive to things. So having something that's hypoallergenic and doesn't trigger any diarrhea and things like that, where you can hide your pills, is always a benefit. So we have things like that. We have poop bags on top of the other things to kind of help the gut itself.
Yeah, and those poop bags are extra durable and compostable, which I think is fantastic. And I just want to put a plug in for treats because, as I mentioned in the introduction, as we were starting out, it's been so challenging for me to find something that doesn't tend to upset their biome when I'm treating. And, I've used everything from boiled chicken to just trying to be so careful, but it's still problematic at times. So keep those products coming for us.
I have to tell you, I have a patient who's very sensitive. And sometimes I'll just take a little bit of the pill putty and put it on my pinky finger and lick it just a little bit while we're doing some exercises. I love pill putty. I wish I had invented it. It's brilliant. We were talking off the air about a patient, Chris, that is a breed that typically gets allergies, and she's afraid of people. She's afraid of other dogs. She's sound phobic, but also she has a CCL tear. And I was talking to Dr. Cooksey about how this whole big picture just sort of emerged while we were talking about her, about how she's a great candidate to have her microbiome tested because she has these fears. She has aggression. She has a CCL tear in a breed that doesn't typically get one. And I know that they can, but it's not my typical breed that I see. Plus the allergies on top that they haven't been able to identify. So she's itchy all the time. But thinking outside the box, I think, is what I'm trying to get here. What I'm trying to get at. So it's just very interesting.
Yes. And you've used the phrase before, Kathy, which I love, which is the more we know, the more we grow. Right. So every time we have a guest, my brain just lights up with all the possibilities of, sharing this information and how many could benefit from it. Thus, us wanting to do this podcast in the first place, but also in our personal lives with our our very own patients. And thinking about this too, I told you that my journey, started with the typical, diarrhea, some inappetence, some nausea, occasional vomiting. Then I thought about Baxter's anxiety. Baxter also has the itchiness. I will see it when he's stressed or anxious. He'll start itching, and he has always chewed at one side of his abdomen, the left side, and there's no hair there. I've used ointments and, different things to try to address it. And again, ever since a young age, and he's had various standard tests, and the typical Western medicine has not discovered the cause of why he goes at that area. But now this makes sense, right? The gut. He's attacking his own gut, basically, with his mouth.
And this dog I was talking about, she's a brachycephalic breed. And Dr. Cooksey and I were talking about, well, I wonder if she was born cesarean section and didn't get that, what she needed from her mom. So it's all very, very interesting. Like, it becomes a much clearer picture for me when thinking about that dog now.
Yes, yes. So are there any resources for our listeners out there? Your website? Are there specific books or articles or research that you'd like to point them to specifically regarding brain health?
Honestly, I hate to toot our own horn, but I think the website, the animalbiome.com, would be the best place for them to start. And it's because we do have blogs, we have articles, we have things written specifically for the pet parents so that they can do that deeper dive. We have links throughout there so they can even go find some of these other blogs and articles related to some of these disease processes that are going on in their pets. So that's always a really good source, I would say to start with. And then, of course, if they have a veterinarian that's interested, like I said, they can go to the .vet side. And with the .vet side, their vet can look at those really detailed research articles, things like that, too.
Toot away, Dr. Cooksey. Toot, toot.
Yeah.
No pun intended.
Yeah.
Given the topic here. But yes, Kathy and I both looked at the AnimalBiome website, and it is full of information, both for pet parents and veterinarians. And just once again, it is AnimalBiome.com. And the link will be in our show notes as usual. And I guess I have one final question. I had recently heard, probably again in the last 10 years, about doing fecal transplants, pets that have GI issues. Is this, because you mentioned the yellow soup with the Chinese medicine, is that still happening? Is that part of this whole biome, or is this replacing the need for fecal transplants?
This is the biome. So this is what we're doing now. So what we offer at AnimalBiome is actually stool material in capsule form to actually provide those native dog or cat specific bacteria into the gut of your patients. The veterinary side in general, just medically, they just released what they're calling a compendium, which is basically a guideline for other veterinarians to actually do fecal material transplants in practice in order to really help get these kiddos on the right track. Because we know from research in livestock and research in lab animals and humans, honestly, too, that by getting those actual bacteria from that same kind of host animal makes a huge difference when we're talking about probiotics.
For clarity, then, you do have formulations that are in, like you said, capsule form, powder, what have you, that is actually the biome from the feces, from the gut. Is that right?
That is correct. The capsules contain the fecal material, the poo material that actually has those bacteria, the fungi, all the little microorganisms that these animals need.
In a dried form within that capsule?
Within a dried form. It's a freeze-dried form, actually.
Okay. But then I got a little confused because you said that there's a compendium and they're actually still doing fecal transplants as well.
Yeah. For the severe cases, the veterinarians can actually do an enema where they're actually doing the transplants that way. It's actually something that's been done on human side since like the early 1950s. And actually 2022 is when the FDA approve fecal enema transplants in humans as part of the standard of care if they had a clostridial infection that was not responsive to antibiotics. So now that's the standard of care for humans with that. And so we're really focusing on trying to see this also evolve on the pet side as well.
I've known a few dogs that have undergone that. They are part of an EPI group, which stands for enzymatic pancreatic insufficiency, I believe. So these dogs often have altered microbiomes and chronic diarrhea, and the fecal transplants really helped. And in fact, the vet that I have been referring to throughout the podcast, she also does them, but fortunately we haven't needed that. Dr. Cooksey, I am so glad that you pointed out that these fecal transplants are done via enema and not actually ingested orally, as was implied with the yellow soup in early in the episode. So not as horrible as it may seem. And if it works, I'm all for it.
Dr. Cooksey, do you have any last thoughts you'd like to leave our audience with? Any words of wisdom or pearls of information?
I think we've kind of covered it all, but the main thing is, I would say, when you're seeing these symptoms occur in your pets, and maybe we're trying our best to get them under control and our typical methods aren't working, think about the gut. And remember that a lot of what goes on with the body ties back to the gut. So maybe we just need to dig a little bit deeper and see what's going on with those little bacteria in there.
Hear, hear.
I'm always interested and concerned about the emotional lives of animals. And my gosh, if there's one thing I could say about the emotional life of animals and their overall health and their mental well-being is check that gut.
Yes, Kathy. And someday I'm longing for that lab that can eat anything and doesn't have diarrhea following. Maybe that's one of my bucket list things. So
it's all about the poop.
It's all about the poop.
All right, Dr. Cooksey, thank you for joining us. This was so enlightening. It's really got my brain sort of thinking outside the box, and I'm excited to present that to our clients.
Thank you guys for having me. It's been a blast.
Loved it. Thank you so much. Bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.